And joining me now to talk about COVID vaccines for adults and in the future for children under the age of 12 is Dr. Celina Nadelman. She's a board-certified cytopathologist and a fine needle aspiration specialist. She's a clinical instructor also at UCLA's David Geffen School of Medicine. Thank you so much for joining us, Dr. Nadelman. I had to tell you, first of all, you're a cytopathologist. I was talking with Howard, our executive producer, trying to decide whether or not we should have you explain what that is. It sounds very, very difficult, but I think you can tell us very quickly what that is.
It's just a subspecialty of pathology. It's the study of cells. I used to say cells in space. So it's very similar to regular pathology. I do see a lot of things, especially I look for cancer and infection and inflammation when I do biopsies. We all go through this kind of training. I'm just subspecialized in it.
Interesting. Well, tell us about these vaccines then. Certainly you know a lot about this. People are getting vaccinations, about 1 million a day, so more people getting them, but many people still haven't had their first shot. So with your expertise, what would you like to tell people about that?
Well, first of all, I do work in a community of mostly Black and Brown people, so I do understand the hesitancy. I work in South Central Los Angeles, and when COVID was really outbreaking, we were at the epicenter at MLK Junior Outpatient Center and the hospital. So I do understand what people are worried about, but I really wish that they would be able to come to their doctor and discuss their fears and apprehensions because even some of the clinical staff were apprehensive because it was also new. But what I tried to explain to some of my colleagues and to some of the patients was that these new vaccines actually have been on the market, or actually they've been looking at it for over 10 years. They were looking to release a SARS, the first SARS vaccine back, more than 10 years ago, and MERS. But since SARS went away, they didn't actually use it. And so these vaccines are actually kind of miraculous in that it takes a bit of the code for the protein, for the spike protein, and it envelops it in a way so that it can actually get into your body. And once it's in your body, it just encodes for the spike protein. It stays outside of your nucleus, so it doesn't affect your DNA. I know there are a lot of rumors about that. And it codes specifically for the spike so that your cells can then recognize the spike that's on the COVID virus, the SARS-CoV-2 virus, and mount an immune response using antibodies as well as other things that help fight virus infection.
So, doctor, why then is it not being used in children under the age of 12? Of course, we want to be extra careful with that age group, but children are back to school now, and there's so many parents concerned because their children may be exposed.
Yes, it is very concerning. And, with the first variant, it seemed that a lot of the children seem not to be getting infected with it or even passing it along. But now with the Delta variant, it's affecting a lot of these um, uh, patients, not only unvaccinated adults, but also the children. And a lot of the children are actually getting very ill, and some of them are being hospitalized. So I understand the concerns of every parent out there. The only reason that I can think of is that they want to make sure that the dosage is correct for children under the age of 12 because their immune system is different from adults. They mount different types of immune reactions. They may not need as much of a dose, and you don't want to have too much of a reaction to a vaccine. They want to make sure that there are no adverse events or side effects that are worse than getting COVID itself. So that's the only reason why I'm thinking it's taking this long. They need to have vaccine trials. They need to make sure that the trials are diverse, and they need to really make sure that it's safe. But from the studies of children or teenagers over the age of 12, to 18, thus far, we've seen that the vaccine has been working really well, and there are very, very few side effects from the vaccine itself.
Well, thank you so much for clearing that up. It can be difficult to understand all of this when you don't have that medical training. We appreciate you joining us here on BNC. Take care.